On the new Talk Radio 1450 WCTC. Call Jersey Central at 732-545-9282. Toll free at 888-545-9282. Watch Jersey Central live online at WCTCAM.com or listen on your smartphone with the iHeartRadio or TuneIn apps. Connect with WCTC on Facebook, Twitter, Instagram, and YouTube by searching 1450 WCTC. And now back to Jersey's Morning Show. Jersey Central with Bert Barron.
8:37, we're back on Jersey Central on the new Talk Radio WCTC, the voice of Central Jersey. It's Bert Barron. Hello to you from inside the Forge Jeweler Studios. We got our Need to Know Things coming up a little bit later on in this 8:30 half hour of the show. A brand new survey of physicians find that people who suffer from gout, just the word alone makes people cringe a little bit, right? Unfortunately, they often blame themselves for the condition and sometimes might even feel embarrassed about even having it. My guest today on the Jersey Central Newsmaker Hotline says the fault that gout patients may feel is misplaced. He's got the results of the survey and facts about the so-called disease of kings, as it's known. We have Dr. Paul Doghramji, who is with us here this morning on Jersey Central. Dr. Paul, welcome. How you doing this morning?
Good morning, Bert. I'm doing great. Thanks for asking me on the show.
This has been described as, God's way of leveling the playing field. He makes women give birth to babies and go through that experience, and he gives men gout just so that they know what a painful experience that is. Is that kind of accurate when you compare the two?
Well, who am I to argue with God?
Right.
What I can tell you is that gout is a hereditary problem that's been around for many, many years. And just like you said, a lot of patients have a misconception that it has something to do with what they're eating or what they're not eating. And like I said, it's hereditary. It's a serious long-term problem of too much uric acid in the blood. And this is a kind of a problem that has been going on for many years in a patient. And after 10, 20 years or so, the uric acid accumulates to a point where in the joint it causes a very painful gout attack.
And some people say that, I guess this misconception that it's from shellfish, it's from butter, and it's from diet and whatnot, but you're saying heredity is the main contributor here?
Yes, not to say that it's perfectly fine to have butter and shellfish, but no, it really is hereditary. In fact, what we find is that patients who have gout, if they do stick to a very good gout diet, let's say, they're not going to lower their uric acid to where they need to be in order for them to be under control. And that number is a serum uric acid of below 6. Now, all patients who have gout should know what their serum uric acid level number is, and that should be below 6.
Is that determined by a simple blood test with your doctor?
That's exactly right. Patients who have gout need to go to their doctors and get a blood test done. And it's a simple number that all patients should know. Patients know their number for blood pressure, for cholesterol, for diabetes, and now they need to know their number for uric acid.
Aside from prescription medication, are there some other ways to maybe treat it? I mean, you start to feel that little something's going on, like in your ankle or your knee or something in your foot, and you're like, oh, man, this comes and gives a full-blown gout attack. I'm going to be in big trouble. Is there anything that a person can do at that point when they feel an attack coming on?
Absolutely. As far as an attack is concerned, if a patient knows that they're having a gout attack, they'll usually go to the pharmacy and get an over-the-counter medicine of the anti-inflammatory type. But more often than not, it's not going to be sufficient, and they're going to have to go to their clinician to get a medication that really works to make that gout attack, which usually lasts about 2 weeks or so, to make it last a lot less. But Bert, that's just the tip of the iceberg, because gout attacks, which may occur 2, 3, 4 times a year, in between these attacks, that serum uric acid level is still very high, and it's continuing to cause joint damage throughout the years, so that people with an elevated uric acid under not control will have a higher probability of osteoarthritis. So it's not just important to get rid of the attack. It's very important to lower the serum uric acid level down to below 6.
That's a long-term problem that you'd have to deal with for the rest of your life. So getting this under control as soon as possible sounds like the thing to do. Doctor, I've heard people describe it as putting a golf ball in your shoe and running a marathon. Is it that painful?
Well, I've never experienced either gout attacks or a golf ball in my shoe. But people who have gout tell me, and by the way, women also get gout. You said earlier that it's primarily men, but women do get gout in a 1 to 3 ratio. They do say sometimes that it's almost as painful as childbirth. So it is a very painful condition, and patients that have it do want to get their treatment to get rid of the attack.
I'm having trouble wrapping my head around the concept of people that are afflicted with this feeling embarrassed about it. Why would you be ashamed? Why would you not want to get it under control and get some help for yourself?
Well, a lot of people have the misconception that it's because of something they're not doing. Maybe they should drink less of this. Maybe they should eat more of that. It's just like anything else with blood pressure or cholesterol. They feel embarrassed that they're not doing the right thing. But, I think the key is to understand that when they go to their doctors who can give them the right information that it's a hereditary problem, they can get medication. And currently, by the way, the two medicines available to lower uric acid, they're in the xanthine oxidase inhibitor category, allopurinol or uric. A lot of people with gout have heard these words. But, those alone don't seem to bring the uric acid level down to where they should be in a large portion of patients. And by the way, the survey you were referring to, a lot of doctors felt this frustration that they weren't able to do so. And now there's a medicine which is called Zerampic that just came out, and it's made by Ironwood, and I'm here with them today. And what they found out is that when used in combination with these xanthine oxidase inhibitors, Zerampic was able to lower the uric acid even further. I should tell you that in some patients who took the medication alone, they experienced acute renal failure a lot more than when they took it in combination. So patients should go to their doctors, find out what their uric acid level is, and find out what medications that they're taking, and see what they need to do about it.
Yeah, and you can visit the website. Is it goutisserious.com, doctor? Is that where you want people to go?
That's exactly right, Bert. This is a very important thing because there's so much information out there, so much misconceptions. We've talked about that with patients. But if patients want to get the right information about gout, this is the right place to go to. It's called goutisserious.com. It gives all the information about diet, exercise, weight loss, medications, the right number, goutisserious.com.
And if you want to see what someone who has gout is going through, if you just Google gout and go to an image gallery, you'd look at this and you'd say, oh, my goodness, this happens to people? Why would you not want to get this under control? And it's just it's tough to look at sometimes and incredibly painful for the person that's going through it. But it's good to know that there's help out there and there's ways to control it, doctor. And that's kind of the main reason why you're on with us here this morning.
Absolutely, Bert. That's exactly right.
All right, good stuff. So goutisserious.com. You can check out that website and get some more information. And it has nothing to do with eating red meat and drinking fine wine. No connection, right?
Very little. Very little.
Right, very good. Dr. Paul, thanks for being here this morning. Good information, and keep spreading the good word about this, all right?
My pleasure, Bert.
All right, thank you. All right, my guest on the Jersey